Good morning. I am Dr. Naufal Rizwan, a specialist internal medicine from Allevia Medical Center. Today we are celebrating the World Heart Day. So every year we celebrate the World Heart Day on September 29. So the main idea is to raise awareness in the general public about the heart diseases. So why so much importance is given to the heart? This is because cardiovascular disease deaths are the most common cause for non-communicable disease deaths in the world. So today I am joined by Dr. Anwar, another specialist in internal medicine from Allevia Medical Center. So
doctor, I would like to know who are the patients or people at risk of developing heart disease.
So there are 6 or 7 important risk factors for the heart diseases. So the most important one is the high cholesterol level that we call as a hyperlipidemia. Then high blood pressure, diabetic patients who don't work like sedentary life habits, obese patients and smokers, and if there is any family history of heart disease. So these are the patients who are at more risk of developing a heart diseases. So Dr. Anwar, then how do they present? So what are the usual symptoms of a heart diseases?
Well, the usual symptoms of heart disease, as we all are aware, most of the patients present with complaints of chest discomfort or chest pain. Diabetic patients obviously can present just as sweating or just discomfort, and some people may present with breathlessness on doing some activities, and sometimes they present with palpitation, that is an undue awareness of our own heartbeat. You feel that your heart is beating just like you are after we exercise, you feel that our heart is beating, just like that you feel it at rest. It may be, these are all the usual and common symptoms. And other symptoms include giddiness, especially giddiness on exercise. These symptoms point to probable heart disease. Well, Dr. Rizwan, how when we are discussing about heart disease, one of the questions we generally face is how do we diagnose this case? What are the tests? What are the investigations needed for diagnosing this type of heart diseases?
So that's a very important and good question. So the first thing is always about the clinical examination. Whenever a patient presents with a chest pain or breathlessness or palpitation, as told by Dr. Anwar, we examine the patient first. Then there are some important tests to diagnose the heart disease. The first and foremost is the ECG. So whenever a patient comes to us, the first thing we do is to take an ECG to rule out a heart attack, because most often the heart attack can be diagnosed through an ECG, but not for all patients. So in those cases, we also go for some blood tests like troponin. And apart from this acute episode, there are other tests that are also available for the heart disease. Echocardiography, which can completely tell about the various dimensions of the heart and the heart function. And sometimes we also advise the patients to go for a treadmill test. We'll ask the patients to run in a machine and observe the heart function. And finally, if still the patient has got some doubts whether he has some heart problem, then we advise them to go for a angiogram. There are 2 types of angiogram, one through a CT angiogram or the conventional angiogram. But angiogram is usually the last resort.
Yeah, okay.
Mostly the patient can be diagnosed through the ECG or echo and the TMT. So Dr. Anwar, so what are your advice for the healthy heart?
Well, healthy heart, most important thing is quit smoking, do regular exercise, eat healthy and prudently. And if you are diabetic, if you are hypertensive, if you have hyperlipidemia, get adequate and optimal treatment and have a regular health checkup in at least once a year. This will help us to know, to modify and probably treat our heart risk and heart diseases.
That's a perfect advice, and I think everyone has to follow those advice.
Use the heart
for every heart.